Banerjee, Provas Banerjee, product of Bardhaman Medical College. And, respected sir and the gathering here. Now, actually I didn't take any, in my initial years, I'm a 86 pass out MS from Delhi, and I was offered a job as a teaching job in Bardhaman Medical College, and Professor Basu was there. But one thing sir has already said about the course, that is a different national seminars, everything had been done. But I took my real entrance in the private medical college in Katiyar, 2005. Now, when I was in Bardhaman Medical College, actually, what I used to serve in the anatomy department in the afternoons, but the hospital will be teaching, learning, whatever it was in Bardhaman Medical College of today and Bardhaman College of then. The MCI inspection was being held. Now, in that time, I took with my friends and also the teaching faculty to build up this college and build up the department. Now, actually, it is like Rome was not built in a day, but now we are time bound. 4.5 years course syllabus, you have to teach many things. And as sir has said, that like the party meet and all, there's no party meet. And the postgraduates, they are now going and practicing. And PGT are never allowed to practice in other states. This is one point. And one thing regarding anatomy department, there is in present syllabus, the students of postgraduate students. Now I was in high-tech medical college in Bhubaneswar. I upgraded the museum and anatomy labs. Now one thing what is there is that our country is not America. You have to build up your college in a different way and say, as our college is being named Santiniketan Medical College. Now, if you see the ideas of Gurudeva, it is over there the teachers have been, they don't say sir, they say Dada. The Vice Chancellor is being called by Dada. But that's a different issue. But one thing what I'm the 4th generation doctor. I'm located at Shaitia, and our nursing home was built in 1958 when I was a 2-year-old kid. And Soilen Mukherjee of Bardhaman was my father's teacher. Now, I've seen my father practice, I've seen my grandfather practice. Then we were in Bardhaman Medical College with minimum resources. Even cardiothoracic operations has been done in mitral stenosis and many breakthrough operations from Professor Dr. Dept. And I have been medical photography from my student age, and I have a good archive of my patient. And actually, it is the thing you serve 2 hours. You might be a visiting faculty. You give your maximum output. This will be my request. And the thing we want to build up, we have a small 10-bedded setup. But what's our service, like my father, it is like a myth that Sushilo or Hasita দেখলেই আসতে লোক ভালো হয়ে যায়। এটা কিন্তু একদিনে তৈরি হয়নি। তো 58 সাল থেকে আজ পর্যন্ত I was rushing through seeing patient and I have lodged here bit late, half an hour behind time. Now what I feel is that students, teachers participation, that's everyone knows And one thing, the feedback. See, I'm saying high tech. Now, what is happening? Why it is, at least this is my feeling, that why students or pass out as a postgraduate, say radio diagnosis. Now, at the end of the report, they are writing clinical correlation must be done. It might be a high-end technology being used in biochemistry, high-end technology in radio diagnosis. Why are you saying this? If you have at least a Cox, frankly, by the history and everything, you are seeing a X-ray, radiological plate, X-ray of chest. Over there, no proper like Cox. I know, my father, we had a small X-ray unit, but he used to write the report and he used to prescribe ambristrine in those antitubercular drugs. Now, this is the main key thing that, see, I used to go to high-tech board research 4 days in a month. And it was a challenge for me. Professor Basu put up the challenge. And the radiology section of anatomy department, I have transaction of the whole body and place them chronologically by numbering them. The brain, the arm, the abdomen, thorax, and number them and see it is some very thin slices in the thing in your MRI or CT scan plate. But these plates I demonstrated over here like self-learning. A postgraduate who's doing who will do future MD in radio diagnosis, he can go to the anatomy department and see for himself. Okay, it might be so such thing, but the tumor is say is 2 inches or 3 inches, and that can be, you can gauge that this is the tumor over there. Now, this is the main thing. At least I have a dream. This might be the last milepost for me in the anatomy department to build up the story and also think. Even MBBS, of course, you are thinking. But for the postgraduate level, then you have to have skill labs. Now, orthopedics, I'm doing orthopedics in present day scenario in all colleges. Most of the colleges don't have, I don't know, I'm not visited like Manipal or something like that, but that the orthopedics MD student or MS student goes to the anatomy department and sees them. It can be like this. MS, gastroenterology surgeon. Now, we can give you protein material for different anastomosis. Previously, whatever the boss, say one story I'll tell you, Professor late Provas Banerjee HOD. One day, a patient admitted with the intestinal obstruction, blood cut, like volvulus, but this thing. I was the house staff. I prepared the patient and I called Professor Banerjee to attend, and he opened. And what he did, he said, Provas clamp down. Suture down, safe down, charge. These fantastic suture materials are there. But he did it. And that person lived for 5 years or more. Now imagine what we would do when you see them close and then you won't be, but he's given relief to the patient. This is the idea that what we are lacking is real interaction. And everyone is busy. My grandfather, he was a doctor. He used to say say, rolling stones gathers no moss. Like you are having Banerjee in one chamber, you are having in some other chamber, or going from Calcutta Medical College, you are Gorihat, one chamber. Then you go to Goria, one chamber. You go to Bypass, Baguyati, one chamber. At the end of the night, you are in Salt Lake. Now, can a person, but this practice we are seeing, you are not doing judgment to your patient or to yourself, at least I feel that. So, let us look forward. In the future, we will have more interactions and build up this college, as previous speakers have said, and another proposal will be that the skill lab should be built simultaneously. And you motivate surgeons, he can be a visiting. Like this one thing, I happened to meet Professor Jackson. He is a craniofacial maxillary surgeon. And if he is 10 days in New York, the other 20 days he is throughout the globe. Now, if a laparoscopic surgeon or teachers who have retired, this can be, he stays for 5 days or 7 days or 10 days and teaches batches of students. And practicing doctors also. Now, this center I will be proposing to Professor Sir and also the Chairman Molai Babu, because these things are lacking. Once, I'll tell you the picture. Diabetologist, he comes in a week or 50 days and he is in his chamber of diabetic foot ulcer, complication. Now, he takes his handkerchief and sees that. You have to touch, you have to feel. You have seen that Hippocrates picture, that is only the touch and feel is consoling the mother, that your child, don't worry, everything can be depicted in one picture. So we want to do a radical change, start from field. Because see, you audit, what is the main thing is that I've been doing appendicectomy. Okay, now why 4 appendicectomy I have done on Monday? But and only 1 got infected. But the 3 went on well. And many things, our issues are there, we can discuss in different forums in this college, different seminars. But please, what we want is that you all come, and then also pollution free, more or less, except this thing, Santiniketan and this local area is a pollution free. And also, I invite you all at your leisure to come down to get the forest field with a water body around 16 bighas, with more than 35 acres of land, with all different types of fruit trees, coconut trees, and many things. And the birds also come in this winter session, the migratory birds. I built up a nursery, you're welcome. And I'll give when we interact, we'll give you a phone number. You can contact my daughter. She's running this place. We have not developed a room or something like that yet, but we will interact. If you want a break, you can go there and spend your day. Thank you.